Okay, so after your surgery, Dr. Rutledge, you don't digest and absorb as much fat. Because fat's difficult to absorb, so you can't digest it. And that's why oftentimes if you eat a big greasy meal and you turn around, you may find it in the toilet. We call it Agent Orange. That's the grease, the fat that's undigested, stays in the gut and falls out into the toilet. So what about my thyroid medicine, Dr. Rutledge? What about my other medications? What's the deal on those? And the answer is that most medications are different than fried chicken. That could be obvious to you if you look at the two. Pizza, a pill. Pizza is difficult to digest. Most antibiotics, medicines, blood pressure medicines do not require digestion. So as long as you don't have, urgent diarrhea and losing everything right away, almost all medications in my experience are well absorbed, and you do not need to take, for example, a double dose of antibiotics because you have the MGB. You do not need a double dose of medicine. Most medicines we find are well absorbed. Now there is a change in medicines because your cholesterol goes down, your blood pressure goes down. So we change those medicines, but most people do not require an increased dose of medicine because you don't have to digest medicines in most cases. Now, if you are really sick and having diarrhea every day where you lost everything and it went through your gut very fast, it's possible it would make a difference. But most medicines are well absorbed after the MGB, and we do not find you have to increase the dose because of a problem with the MGB.
And how about vitamin pills also? Are those well absorbed?
Yeah, here's the other thing about vitamins. What we have is 10 years worth of data on almost 6,000 people. So we get hundreds and hundreds of blood tests on thousands of people, and what it shows is almost everybody's vitamins and minerals are normal. Now, we do have low iron in women. Okay, we kind of talked about that. There's some other videos on that, so I won't go into that. We've seen an occasional low B12, about the same in which it occurs in the normal population, less than 1 or 2%. And we see a few other things, occasionally a high vitamin A, occasional high B6, and so we have to adjust the vitamins down. But over thousands of patients over years, abnormal vitamin and mineral levels are extremely rare. That's good.